Okay, so welcome ATSU and KCU or Kirksville, right? Anybody else out there? Welcome. I'm Dr. Kendra Morrison. Like I said, I've been giving lectures a couple of years. Trisha invited me. I don't know. My husband hopefully will come and do a lecture at some point. He's an orthopedic surgeon that did a spine fellowship, so he does a really good back lecture. So hopefully you guys will get to experience that. I moved here on account of my husband, but we did both go to KCU. I am board certified EM and didn't actually know that I wanted to do that at first, but once I got into my third year and I liked spending more time at the hospital than I did the clinic, I kind of figured it out real quick. In the process, just a little background. My lectures that I give here aren't typically clinical lectures because as you'll hear, my journey to where I am today is kind of a little bit, went a little off-roading, got back on track, took another route. This lecture today, I just want you guys to sit back and enjoy. Nothing is gonna be on boards about this, but I really hope that you'll hear how the right way to do this moving forward. As you know, if you've read any Medscape article in the last 3 or 4 years, emergency medicines are the highest specialty with the highest burnout. We take the top. We like to be first. We don't like to be first on the burnout, percentage of physicians that are burned out. Unfortunately, we take the top spot several years in a row. So this is one of the things that is a leading cause of burnout in physicians, not just EM physicians, all physicians. So I really feel like just take this for what it's worth. If it triggers you at all, that's a good thing because there are some things here that you can start now that I wish I would have known when I was sitting in your seat that probably would have kept me in the game and not take the path that I had. But good news, I have a journey, you all have a journey, and none of us have the same journey, okay? So, and I'm an EM physician. We cope with dark humor and sarcasm, so this is flooded with my favorite memes. Enjoy. Okay. Oh, which day for staying? Yeah, is it working?
Is it on? I thought I turned it on.
That's a good point.
Maybe I turned it off again.
Oh, no, yeah. I'll just reboot here. On and off is good. Oh, I see the blue light. Okay.
Maybe blue is bad.
Maybe blue is bad. You want me to? Well, I don't know.
It's not moving for, oh my goodness.
Oh, did I do that?
No.
Nope. Okay. Okay.
You already.
Well, yeah.
I don't know if the Zoom people heard you because I muted for a second.
Muted for a little bit. Okay, no problem. So this is me. So like I said, I'm board certified emergency physician. I'm also technically double boarded in health and wellness coaching, and we'll get to that. I'm a medical director, which that was another path that I never thought I'd be. I came back from burnout into a leadership role, which bear with me. I'm also assistant professor, and we dubbed self-proclaimed burnout survivor. So as you can see, there are a lot of paths in medicine. This is also what I want you to hear. You are going to learn how to be a clinician because that's what's important now. There are so many things that we can do as physicians. We have tools. We have lots of gifts that we have to give the world, and they can manifest outside of clinical medicine, okay? So just think on that. As you can see, I'm a mom too. I'm a wife. We're a 2-physician household. These 2 kids keep me way too busy. I have 3 mastiffs that also are a beast to take care of. Like, we are rolling all the time. But just so you know, so you can see me as a real person, you all can do all of this. It's doable. This isn't the things that lead to burnout. These are actually the things that keep you in the game. This brings me great joy to go to the beach and spend some time with friends and family, and it restores me. So one of the things as we get into this lecture that I want you to hear is don't lose sight of those things. You do have time and they are priorities, okay? Advance. So just a quick disclosure side, and I'll get to this too. I do have a side hustle. This is part of this whole board certification in health and wellness coaching. My two lovely partners there are both boarded EN physicians. We make up the whole physician. We co-founded a company where we developed an online course and we do one-on-one physician coaching. And we have a podcast. I'll talk about that at the end. And so lots of exciting things. See, all the things you can do as a physician, super fun. Okay. Next, advance. Okay, so just to preface this, as you saw, the title was Letting Go of Perfectionism. And while we will get into that and how it comes about and what we can do about it, we talk a lot about Dr. Brené Brown. Anyone heard of her? Anyone, Dr. Brené Brown? Okay, so she's PhD doctor, right? She's a clinical researcher. Her research, she's done about 2.5 decades worth of shame research, right? Who wants to admit that they're a shame researcher? She's funny about it. She's super funny. Like she'd fit in the ER because she's super sarcastic. And what she figured out though was perfectionists, there are perfectionists and high achievers, and we're going to get into the difference. But what she says, I love this in her book, Atlas of the Heart, achieving mastery requires curiosity. And that's really the key word, staying curious. Viewing mistakes and failures as opportunities for learning, perfectionism actually kills curiosity. It tells us that we have to know everything or we risk looking less than. And so that's where that little bit of shame comes in. If we have to fear looking less than, we're going to feel shame. Therefore, we'll strive for perfection. And I just want to give this PSA right now. Perfection is impossible, right? Perfection is actually impossible. Okay, next. Okay, so what is perfection? What's a perfectionist? I am a perfectionist, or I strive for perfection, right? These are different things. Well, perfectionist is a person who refuses anything short of perfection. Well, what's perfection, right? Condition, state, or quality of being free from all flaws. Anyone believe that they're flawless in this room? Anyone? Flawless, operate in flawlessness? Well, I grew up in the church. I believe there was one perfect one, and that was not me. Okay, good news, it's not any of you all. So breathe a sigh of relief. We're all filled with flaws, and it's okay. So when we talk about, you can bounce. When we talk about perfectionism, we want to define it and see it for what it is. Excuse me. So adaptive perfectionism is actually okay. This is all of us. We are all high achievers. You would not be sitting in this seat if you were not a high achiever. You have set goals for yourself growing up all through life. Hey, I want to graduate high school, right? I want to go to college. And at some point you figured out, I think I want to be a doctor. So then like next goal is applying to med school, getting in. And now you guys are like, okay, where do I want to go next, right? So you constantly have a goal. You get satisfaction from attaining gold stars, right? We're all gold star getters. We love gold stars, right? We love A+, A-, something like that. It's satisfying for us as high achievers to get the next best thing. When we set a goal, we achieve it, that's satisfying to us, okay? However, we know that our journey has been not a straight road, right? You've learned some ways to study and some ways that don't work, right? You've learned how to manage your time a little bit and some things that don't work, right? Binging Netflix while trying to do pathophys, that doesn't really sink in very good, right? So sometimes you have to turn off the Netflix, right? Or whatever it is. That's a high achiever. That's being flexible. That's doing what you need to do in order to still achieve the goal. A perfectionist, the perfectionist is someone that is very inflexible. So the perfectionist is what we call a maladaptive high achiever. So a perfectionist will not even start a job, right? Because they fear failure. They'll procrastinate. Perfectionists actually achieve, and we'll see this here in a second, will achieve actually less than high achievers because of what we'll talk about. So if you want some proof, right, I'm not just speaking from personal experience, as well, I am trying to give you my testimony. There is actually some articles out there about perfectionism. So this one comes from the International Journal of Medicine. It's pretty recent, 2020. So what are those things in medical culture that really get us where we're at, get us to nurture the perfectionism in us, right? So we have teachers, right? You guys are learning right now. You're on clinical rotations and you have attendings. And let me tell you, we do not do a good job of mimicking the behaviors we wish for you to move forward in, right? It's a very, taking care of medicine, it's a demanding career. And in order for you to be in it to win it, there has to be an amount of flexibility and courage that perfectionism does not allow for. So you have learners that you watch us do the wrong things and therefore you're like, oh, well, that's what made them successful. Maybe I should avoid errors and try to strive for perfection and look. And, while we say practice medicine with excellence, excellence is key, meaning you always want to do the right thing for the patient. That never means that we want you to be perfect, right? Then you've got your triggers of shame. So anyone gone on rounds yet, pimping rounds? Anyone been involved in an M&M yet? Oh yeah, public display of shame. We're real good at that, right? A bunch of doctors sit in a room, flash a case up there. The ones that are invited are the ones that were involved in the case. And they sit there and go, oh, why'd they do that? That should have never happened. Who didn't call there? Why was that consult not made? Who gave that dose of medicine, right? And you're in your chair like, right? You just want to like beeline for the exit, right? Okay, so that nurtures that perfectionism, meaning like I'm putting my case up there. I feel like a failure and not, oh, interesting. Yeah, that seems interesting. Maybe I can learn from the case instead of feeling like, oh, let's just put up here everything I did wrong, right? And then the old imposter phenomenon, right? The imposter syndrome. We love when it rears its ugly head. That's the extreme self-doubt, basically where you feel like you got here on luck, right? If you think about it, if you just got in here on luck, how many more medical students would there be? 3 times, 4 times, 5 times as many, right? No, you're an elite bunch of very smart and creative people that got here because you are gifted and talented. It's not based on luck. And another thing that we'll talk about is imposter syndrome also almost puts up a barrier or a deflection to internalizing your own success. And one of the things we'll talk about that beats back perfectionism is celebrating, is internalizing the success that you've had. And then the showmanship, right? We make a whole thing on the white coat ceremony, right? Put the white coat on, you're a doctor, right? Like, oh no, you're not, right? And then you graduate med school and you're in residency, you get the long coat, right? And you're like, oh, I'm a doctor, right? No. But we make a whole showmanship out of it, and there's just a lot of that self-doubt can still be there, but because you put on the coat, that's you're hiding it now, right? It's a what I want to say, like not a literal but figurative like coat to hide all your self-doubt and insecurity. And then you've got the family and friends, right? As soon as you got into med school, how many family and friends called you? You're like, so I have this rash, so I have this lump. Yeah, so could you look at this? They start sending you pics, right? Texting you pics. You're like, I don't even know what part of the body that is. Like, you're too zoomed in, like zoom out, like where is this, right? And then they expect you to diagnose. So all of these things build that anxiety about, well, can I even do this, right? Next. So, like I said, perfectionists tend to actually achieve less than high achievers, and we'll talk about why. Next. Okay, so this is a depiction from verywellmd.com. They have like really cool pics, so we use them a lot in our lectures. But this, we're going to go into all of these. We'll talk about all of these, but this is just if you can visualize traits of perfectionism. The only thing we wanted to add was rumination and all or none thinking, and we'll talk about that. But as you can see, we got this guy over here not even starting the race. This chick's running the race, but look at the goal. And this chick's over there with scissors, like trimming the lawn. Come on now. Okay. All right. Next. Okay. So anyone heard of Tal Ben-Shahar, Pursuit of Perfection? Anyone? Okay. So he is, he was a Turkish, he was a handball player or maybe racquetball. It was one of those, right? And like, it's huge over there. And he was like a world champion But he writes these books out of the consistent pursuit for him to be this perfect, I think it was some kind of racket sport. And he never achieved it, even though he was like world champion times, however many times, he still felt like he was not enough. So anyways, he wrote this book, The Pursuit of Perfect. And so it's how to stop chasing perfection and start living a richer, happier life. And it's all about being present. But what we'll talk about is the 4 traits that he says differentiates perfectionists versus high achievers. Now, you guys will relate to some of this, and all of you are going to be on this spectrum. But I just want to give you guys a perspective of what it looks to maintain your high achiever versus kind of crossover into the perfectionist. So let's talk about failure. So failure's big, right? We always think about failure. If you get a big F, right, in high school or college or whatever, you fail, right? There's not like anything else. Well, a perfectionist is going to actually just avoid failure. So what tends to happen is you'll talk yourself out of applying to med school, or maybe you're thinking about being an orthopedic surgeon, but you talk yourself out of a fellowship because you're like, well, I got here, I'm good enough to be here, even though I really just want to do sports or spine or whatever, but you talk yourself out of that because you don't think you're good enough, or you feel like you might not get into fellowship, right? So the perfectionist will just not even fill out the application for fellowship. Whereas high achiever, they know that, okay, hey, I like orthopedic surgery, maybe I want to do this, and I really like kids, so maybe I'll do peds, or I really like sports, so maybe I'll do sports, right? And you realize that, hey, it might take me 1 or 2 or 3 times to apply for fellowship and actually get in, right? That's part of the process. So I want you to hear that. It is not about perfection, it's about the process and progress, right? You're always moving forward. You are going to have trials and tribulations, you're going to have obstacles, but it's about your progress. And we'll talk about how to keep that in perspective. Okay. So, like I said, high achievers, they know they need to fail forward, meaning they're expecting it. It's part of the journey. I know that I want to apply to one of the most competitive fellowships, and I probably have to apply 1 or 2 or 3 times. I might have to make some connections, whatever. It's part of the process, the journey. Whereas a perfectionist will say, if I don't get it on my first time, that is it. I wasn't meant to be, that is all she wrote. And I failed because I didn't get in, I'm never applying again. It's an all or none thinking. It wasn't even like, wow, what did I learn from my first interview or my first fellowship application that I could improve on or apply to this next time, right? That's not in there. And then we talk about the procrastination. So you fail a hard time. Maybe you don't even fill out the application because you're like, yeah, no, yeah, no. I can't even face the fact that if I would have to apply again. So I'm just not even gonna do it the first time. Okay, next. And this is me. I'm a perfectionist with a procrastinator complex. Someday I will be awesome. I have this magnet, actually. Okay, Dr. Brene Brown, when she was talking about her shame research and what the traits of perfectionism, I love this quote. She says, understanding the difference between healthy striving, so being a high achiever, and perfectionism is critical to laying down the shield and picking up your life. Or I might say taking your white coat off and picking up your life, right? It is about, and I love this because this is a huge shield, but we could have this big of shield. Maybe you're just, feel fearful of what your attending will think, or what your colleagues will think, or whatever. So your shield's only this big. Or maybe you're scared of taking the whole next step. It could be in a relationship. Maybe you're in a relationship right now and you're fearful of taking the next step. What if I fail at being a partner or whatever? Like, it could be anything. But what we're saying is no matter how big your shield is, part of what staying as a high achiever is putting that shield down and actually recognizing that this is a part of life. Okay? So now let's talk about feelings. Ooh, feelings, emotions, right? Well, when we talk about feelings, negative emotions is the ones we tend to avoid, right? It's uncomfortable, icky, like we don't want to sit in the uncomfortable. We've been programmed all our lives. We have positive and negative emotions, but maybe can I offer up that all emotions make up the whole of life? The ones that we may label as positive, the ones that we may label as negative. What if I told you it was required to live a fully fulfilled life to experience all ends of the spectrum, right? Could that be possible? Well, perfectionists will say no. It is not good to feel uncomfortable ever. I will avoid this at all costs. Whereas the high achiever will say, the reason that the word human is in humanity is because we experience all the things, right? Okay. Next. And this is my favorite. This is my favorite. You are here in the dumpster fire. That's where I work. And then I'm always the box trying not to break down. Trying not to break down. So like I said, this is the feelings wheel. Who's heard of the feelings wheel? Okay, I love it. If you haven't, go check it out. I have the reference right there. So why put this up there? It's funny. It can be overwhelming. Some people, if you don't know this, you're like, what? There's this many feelings. But what I really just want you guys to understand is when Brene Brown was first doing her research, the first few surveys she put out, on average, I think she had about 2,000 to 3,000 college students that took these surveys. On average, they could name 3 emotions. What do you think they were? Happy, sad,
Angry.
mad. Happy, sad, mad, across the board. 3. And then after she showed them the feelings wheel, right? They're like, what do you mean? There are all of these. Are you kidding? So what we have to realize that as high achievers, striving good enoughness, right? We have to realize that sometimes it may feel like happy, sad, mad. But if you were to think about it, how it's showing up, maybe the sadness is really just confusion, or maybe it's feeling distant, like I feel disconnected, or maybe happy could be powerful, peaceful, or trusting. So what I just want to get across is, yes, happy, sad, mad, it seems like pretty rational and reasonable, and we're kind of left-brain people, so that seems like that's how it works. However, all this is in entertaining our right brain and can show up as any of this. I remember some of the first work I did with my coach. Mad was my go-to. Anger was comfortable, right? I could hide behind anger. I could stay in the cave. It was safe. Reducing what this possibly could be. One of the things that I figured out was, like, one time I felt dismayed, that it showed up as anger because that's how everything showed up. But I was like, told myself, actually, I'm a little dismayed, right? I'm a little dismayed. And then I sat with that, like, oh, I can deal with being dismayed. Like, that seems reasonable. You know, it just deflates anger a little bit, or it disperses the fact that I was feeling a negative emotion, right? So what I really just want, big picture, is sometimes when you show up and that perfectionism, the fear of feeling, or just not wanting to feel these uncomfortable emotions, what is so empowering is when you understand that actually when I peel it back, I'm just feeling perplexed. And you can name it, and then you get to choose where to go next. It's very, very empowering to be able to name what you're feeling and then be able to decide the best next steps for you. Okay. All right, rumination. Anyone know what rumination is? Anyone gone down, anyone just kept on that spinning wheel of rumination, right? So this is overthinking on meth, right? You might know what meth and amphetamines are. Okay, well, we're in the 417, and I take care of all of the Mexican Americans here, okay? So rumination is overthinking, but it is constant. And not only does it not, is it a movie reel playing over and over, but you continue to feed into the cycle, and then you go down the spiral, right? Because you feel bad that you're thinking the same things over and over, then they make you feel bad. So you get more negative thoughts, which make you feel worse. You know, anyone, just me? Okay. So this typically is a very negative wheel. This is a cycle that you have to understand that we all go through, but there are ways to get out of it. When you ruminate over and over, it's really hard to see a different perspective, right? You kind of like dig yourself into a hole, and it's very difficult to get out of. However, if, say, on the perfectionist side, you were fear of failing, but then you had a friend that came in and said it's all part of the journey, imagine just that one little reframe of that thought really can get you out of that cycle and help you to move forward. But just keep in mind, rumination. Okay, I think the next one, yes, Edwin Bliss. Edwin Bliss is an author, anyone read in books? They're really towards business consulting because they're about getting things done, fear or push through procrastination or something. Anyways, but what I love is this: the pursuit of excellence is gratifying and healthy, right? We talked about being excellent. The pursuit of perfection is frustrating, neurotic, and a terrible waste of time. Okay, so we're moving on to success. So, I mean, success, who doesn't want success, right? Well, the perfectionist frames it like this: I have set such unrealistic goals for myself that on the way there, I'm not even gonna stop to celebrate every small step it took to get there, right? Because all the focus is on the unrealistic expectation or the goal that's way out there. And there's no room for internalizing the success or celebrating when I have small successes. Versus the high achiever that sets goals based on in reality and celebrates along the way. One of the things we do in our curriculum is when docs come and want to set some new habits or goals, we set the goals, the big goal, and then you make action steps to get there. What are action steps? Well, they're broken down, smaller steps. What do? They remind you to stay on track, number one. They keep you moving forward because every small step you celebrate, you accomplish, you move forward, and you're able to remind your brain of the progress you've made. Remember, it's about the process and the progress, not perfection. So high achievers set the goals, but then set doable action steps to get there and celebrate along the way. Okay. All right, so a little bit unrealistic standards. Like I said, high achievers set high goals, but tend to be happier along the way. Because like I said, we celebrate along the way, we internalize our success. Perfectionists set the goals way out of reach, focus on the goal, they avoid failure, and then we start to ruminate or beat ourselves up when the negative feelings come, right? We go back to our feelings wheel. Okay. All right, the all or none thinking. I mentioned this before. So this is actually a thought disorder. So what does this show up? Well, as an ER physician, if I go on shift and I see 19 patients and I was able to nail the diagnosis, get them dispoed and move them along, 18 of them, but one patient really gave me a run for my money. Guess what I go home thinking about? The one patient. So 95% of my day went well, but I can only think of the one that gave me a run for my money. And it could have been anything. They either were like yelling, calling me everything but a white lady, or the dispo didn't go very good, or maybe they didn't respond to treatment very well, whatever it could be. I go home ruminating on the one patient instead of saying, you know what, 95% of my day went well. In my book, that's an A. I'm good with an A, right? Now, we do in medicine, you're gonna hear that there's so much emphasis on this life or death. You have to make decisions based on life, not death. But let me just offer up, there are outcomes that will happen despite you doing everything you know how to do, A to Z, that you have zero control over, okay? Outcomes will happen. So if an unexpected outcome happens, it's up to you to keep perspective on that outcome and not hold on too tight, right? There will also be patients on the flip side of that will do well, that you're like, how in the world, right? My 76-year-old AAA patient that had a blood pressure that I got to surgery and out, and he went home. His mortality at that point was like 86%, and the guy lived, right? There was no way, right? But he went home. Okay, so I can't hold on to that outcome just as much as I can't hold on my 47-year-old that came in and said, please don't let me die. And she coded and we never got her back, right? That just got married 7 months prior to that. And her husband's like looking at me like, right? So both of those outcomes, while both can be triggering, I can't hold too tight about those outcomes, right? It can't be all or none. It can be, I practiced with excellence and did everything I could, okay? All right, this highly critical. It goes with what I was just saying. Sometimes, like I said, if we hold too tight to the outcomes, we are going to turn on that self-critic, that inner self-critic, and just beat ourselves up. And one thing that high achievers do is they remind themselves, I did my best effort. I practiced with excellence. This outcome was unfortunate, but clearly I did my best work, and this is how this day is gonna go. Whereas perfectionists will hone in on the fact that the outcome was met, it wasn't what I wanted, and then they'll either, the imposter syndrome will rear its other ugly head, like, I shouldn't even be here, I shouldn't even be a doctor, I shouldn't have even done this, right? Instead of, wow, like that was not the outcome I wanted, this family is devastated, or whatever it is, but I practiced with excellence, okay? This is Hermie. Hermie's gonna be the most mentally healthy person in the world, right? He's gonna be the perfect perfectionist, right? Okay. Next. Okay, so wrapping up reality, right? So you're thinking reality, well, perfectionists resist reality, right? They have a thing in their mind about the way that things should go. And despite what reality says, they really get fixed. We really get fixed on the way it should be and like reject the way it actually is. Whereas high achievers accept that this is reality and we're gonna optimize from here. So just like I said, if you have a bad outcome, okay, this is reality today. How can I now support the family? How can I now bring this case to our section meeting and educate my partners? How can I, so you look for opportunities to recover in a way that moves you forward. So is that education about like this crazy case that nobody's ever seen and it happened? Or is there some way that we can optimize quality, quality improvement in hospital, whatever it may be? The high achiever is gonna say, okay, I accept reality, this is not what I wanted, but how can we move forward from here? Okay, next. So Socrates says, what screws us up most in life is the picture in our head of the way it's supposed to be, right? Okay, healthy striving, self-focused, right? How can I improve for perfectionism, other focused? What will they think? All of this together can give you life paralysis. So as a perfectionist, I know I missed out on so many opportunities because I was too afraid to put out into the world what I had to offer, right? Because we have that rumination, we have the all or none thinking, and we don't even put it out in the world. Well, what's the antidote? Self-compassion, okay? Self-compassion is the antidote to perfectionism. And like I said, the reason the word human is in the word humanity is because we have to embrace our imperfections. So anybody heard of Dr. Kristen Neff? Kristen Neff? Okay, so she is a PhD doc, and she developed the Neff self-compassion scale. This has gained a lot of popularity in talking about burnout and moral injury in physicians because this is one of the biggest markers. When we do any kind of, there's a Stanford self-compassion or self-assessment, and then there's the Neff self-compassion inventory. And these are the two most predicted in all of the studies that have been done that we've been talking about burnout for like 2 decades. The most predictive level of burnout and moral injury comes from your score on the Neff self-compassion scale. So this is the antidote to perfection, to burnout, really. She wrote this book. This is a great book, Proven Power of Being Kind to Yourself. And she also has now the Center for Mindful Self-Compassion. Oh, that didn't come out too good, did it? But if you want to see how self-compassionate you are, you can go to selfcompassion.org and it's free. You can take it and see what you score. But what she really is helping to bring high achievers, professionals, physicians, whatever, into a state to improve resiliency through an inward focus. Like we said, high achievers, what can I do better? It takes the onus off of what everybody else thinks or the other focus and brings it inward. And it has been shown to reduce anxiety, depression, recover from stress, and burnout, and foster a more balanced, supportive relationship. The biggest key, though, is it's the relationship with yourself. Okay, it's staying in self-integrity and it's fostering an environment of self-compassion. So I encourage you to check out her and her partner that started the Center for Mindful Self-Compassion also have a podcast, if you want to check it out. Okay. All right, so how do we part with perfectionism, right? Okay, well, first off, recognize the point of diminishing returns, right? The absolute definition of insanity is what?
Doing the
Doing
same thing. over
The
and
same
over.
thing over and over, expecting different results, right? Take a step back, recognize the point of diminishing returns, let it go and pivot. Do something different, figure something else out, do something that is going to put you back on the track to forward progress, right? Because if you are stuck in perfectionism, you're stuck. You're not moving forward, right? So we just cut it and go on. Reflect on your progress, right? What did I say? It's more about the process, more about the progress than perfection. Calibrate your standards. Look at your goals. See what you have for yourself. Reflect on that. Is this really aligned with where I want to be, with my why, with why I got into medicine, right? Have you guys ever sat down to think about why you want to do this? Or are you just like, sounds fun, sounds funsies. I'm gonna go to school for like 12 more years after college, residency, and then like get paid like crap, and then get out and be an attending and still get paid like crap. No, I hope that's not what you're in it for. If you haven't ever sat down to figure out your whys or what your values are, I encourage you to do this, right? I didn't do this until I was burned out and had quit medicine, which a little better late than never, right? So calibrate your standards, have measurable goals. That's what we talk about. Have those goals and then create action steps to get there. Realize ruminating isn't helpful. Have I said this enough? Any ruminators out there? Is the light bulb going on, right? And then get perspective. Focus on the big picture. Like I said, realize that what's important, yes, is for you guys to finish, get into a residency and become an attending, if you so please. But don't forget about the other priorities, relationships, fostering your own relationship with yourself, with others, creating a space that's calm, whatever you want, calm, collaborative, cooperative, whatever it is, making room for that. Making sure that you're looking on that big picture and not just trying to survive. I'm just trying to get to today. I'm just trying to get to Monday. I'm just trying to get through this rotation. I'm just trying to get to step 2, step 3, whatever, right? Look for it as the big picture and work towards that a little bit along the way, okay? So this is my favorite one. This is my new mantra since I came back to medicine. And I'll tell you a little bit about my journey. I often call myself a recovering perfectionist and an inspiring good enoughness. Right? Any aspiring good enoughists in the room? Yeah, right. So part of after the fact, just to close, and we'll take questions here in a minute. But one of the things I want you guys to hear is, you know, going into medicine is one of the most noble professions, and it still is. Every single day you get to impact people's lives in ways that you never imagined. Yes, you're brilliant. Yes, you have a whole host of medical knowledge, but you get to connect with them on sometimes the worst day of their lives. That is an honor, right? So when you look at that and have that perspective, everything else that we deal with on the day in, day out, just the details. And if you can reframe just a little bit and know that not only am I want to be a good enoughness, but understand that every institution in healthcare place, you know, shop that you work at are also good enoughness, right? They're not perfect. And there's not a lot that you can do because it's not going to change fast enough for us. But if you can work on the part that you have control over and the things that you can do, then you get that autonomy back. You get to choose and you get to establish it in whatever way you want. And along the way, you'll have wins. And along the way, you're going to feel like you had to learn, right? We talk about winning or learning. It's not winning or losing. Y'all are not losers. You're not failures. You win some and you learn from some. And it's how you continue to get back up and how you continue to keep that big picture in the scope. It is how successful you will feel at the end of the day. And don't forget, even day to day, it's not even that you have to succeed once you get done with third year and then not succeed. Celebrate getting done with third year. Celebrate getting done with this week. Celebrate, passing your in-service exam. Celebrate, I made it through this rotation, right? Every chance you get, because then that will tell your brain, look at how much progress I've made and look how far I've come. And it will keep you in that forward progress. I did not do enough of that. So at some point, medicine became something that didn't align with my values. And I thought I was stuck because I was not moving forward and there was no other chance but to resign. However, looking back, there were some things that were out of my control, but the biggest part is that I had made some boundaries and I was in self-integrity and I made some decisions. And now I'm where I am, I wouldn't go back to change it, right? So if there's anything I can leave with you, be a good enoughness. It is enough. Y'all are enough and you're worthy of this high calling that we share. Okay? Any questions? Oh, 1 minute. 1 minute, yes.
I'm curious what techniques you would have if, like, say you're talking to someone that is a ruminator, but they find the reframe to be invalidating of their feelings.
Sure.
So like, how do you get through to people like that? Or is it just like a smile and wave, nod and listen?
Yes, it can be. Holding space sometimes is all that you can do in the moment. Is just hold that space for them to just like, bleh, right? Also knowing, so going back to the Kristen Neff and her, her work on self-compassion. One of the most validating thing is just to make sure that you stay empathetic. And not meaning like, oh, I feel so bad for you. Like, oh, I'm so sorry for you. Or, oh, bless your heart, right? That's sympathy. That's not true empathy. True empathy is, like you said, sometimes you just have to sit with them in their discomfort, in their rumination, and be present. Just stay with them. Just say like, hey, this is uncomfortable, but I'm not going anywhere, right? And it's those baby steps of just showing up. And then, eventually they may realize like, oh, okay, like it seems like I'm not moving forward from here, and they'll realize. But sometimes it's baby steps, and sometimes you have to reflect. Like I said, that brings up another good point I forgot to mention. If you are having a bad day or you're ruminating and it's you and you don't feel like you can get out of that cycle, imagine yourself talking to a friend. What are you saying to yourself? Would you say that same thing to a dear friend that you saw in this same thing, in the same situation? If it's a no, then that right there should be able to intercept that cycle of rumination and be like, wow, I wouldn't even say this to my, my bestie or my kid. Now that I'm a mom, I'm like, would I say this to my own daughter? She's a freshman in college now. Like, I would never say that to her. Why am I saying that to myself? So it's gaining perspective. And one of the things that Dr. Neff talks about is self-compassion, but also being empathetic in a situation like that. And empathy is hard because you will understand once you get into this, and I've been doing it any amount of time, you're constantly caring for people and constantly giving out of yourself. And so there is some empathy that you kind of run out of by the end of the day, right? But there's always just sitting with someone, allowing for the space for them to kind of think through, and then just offering up that support in the meantime. They'll get there. It's just going to take some time. Does that answer your question?
Yes, ma'am. Thank you.
One more slide. We have a podcast. If you guys love podcasts and have some free time, it's called the Drive Time Debrief. You can give it a listen. My two partners and I, we keep them kind of short, like 20 minutes. But we cover all of this. We talk about like our journeys. We talk about all of these things like perfectionism and self-compassion. We just did one on counterdependence. And so we really dive into some of the stuff that, you won't hear anyone else talk to, but we talk about it because we're, sarcastic and we use a lot of humor. But give us a listen, and you can also follow us on any of the socials. But thank you for having me. I hope that you got at least one thing out of it, a take-home message. And if there's anything I can do for you, please don't hesitate to ask or reach out, because I am your biggest fan. You guys can do this. Yes. Zoom has a question, just put it in the chat, right? Meeting chat,
Or they can.
or you can say it out loud. Still, I am not in between you and the food. I'm gonna celebrate that. Oh, got some skulls up here,
Oh,
little body armor and some smart water.
odd place from skulls, but okay.
I don't know. Anyone have any questions or
I'm not seeing anything.
signing out, signing off?
Not Mary.
How do you recommend reading yourself or celebrating yourself in lost cost ways?
Low cost ways.
Ooh,
What is it?
pat on the back and a handshake.
Oh, low cost. What is it?
Low
How do you
cost.
recommend? Oh, celebrating yourself in low cost? Oh, we don't have to, we don't have to buy anything, people. When I meant by celebrating, yes, I mean, it is nice to go out and do something fun that costs money. But when I talk about celebrating wins, it's really just reflecting on, hey, look how far I've come. I, graduated high school. I got a degree. I got into the medical school. I've made it to third year. This is just those verbal or written reflections, really is about celebrating. Tell, your partner, your mom, your whatever, like, hey, I just feel great this week. It was super tough, but I made it. And like, this is what I learned. Like, even just sharing with someone that you can trust, that's celebrating a win. There's lots of things that I do. I go and allow myself to, have the dark chocolate when I'm like, I worked 3 shifts in a row and I made it, right? So I'm going to get the dark chocolate, but whatever feels good to you, whatever ways, but it doesn't have to be going and doing something or, it doesn't have to be buying anything. It's really just reminding your brain. If you have a goal and you make some action steps, at the end of every action step, I accomplished this action step this week, I'm sleeping in on Saturday or whatever, whatever you like. Or I'm gonna set my phone, I'm gonna read for 2 hours, something I actually like to read, right? Or I'm gonna reward myself with the binge of whatever new shows out on Netflix or Hulu or whatever you watch. These are things like you can reward yourself with like things that you love to do, right? You do medicine all week, like go outside, like have a picnic, like whatever you love to do, that's a way you can celebrate yourself. Like, oh, I'm gonna go for a walk or do a yoga or like whatever it is that you love to do. I'm gonna, if you have a partner, hey, let's go out to dinner or let's just go for a walk on Friday after I've had this super hard day. I just want to reflect back on all my wins for the week. And that way too, you're holding yourself accountable, right? You're not letting yourself get too far down the road without celebrating how far you've come. That's also an accountability thing, but yeah, there's lots of ways. Oh, I'm on the screen.
Yeah,
Bizarre to like see that.
Weird things.
It's like, whoa. But yes, you can celebrate yourself for free. There's lots of ways.
Any other questions?
Anybody in the room? Anybody have anything? Any questions about anything? Being an attending residency, the emergency department, the dumpster fire. Anything?
Why'd you go EM versus anything else in the hospital?
So,
Like, the hospital
to be-
was like shutting you down.
right. To be honest, when I figured it out, I'm a PGY 18, so almost 2 decades ago. There wasn't much options for clock in, clock out. That was actually one of my values looking back. Every single rotation I did that I had to be on call, I wanted to pluck my eyelashes out one at a time. It was the most painful rotation. I started to notice this, like why I was so crabby, like because I have to be on call, right? So I'm one of these doctors that's like anti-call. So it was actually one of the things that was no call, right? And so I pursued it. I think the only other option would have been like, they were starting these hospitalist shifts, right? Where you could be a hospitalist, internist and doc in the hospital, like 7A to 7B, and you go home, right? Or you do like a few on and a few off, or however they do it. Now, there's a lot more choices. So if you want to be clock in, clock off, I am I'm an acute care doc. I love being an acute care doc. That was another part of it. I'm okay, like taking care of you and like seeing you for about 15, 20 and then being like, see ya, right? I don't need long-term follow-up. I don't need to know what happens after. But that's me. So that was also a thing. Like I'm very, very comfortable with acute care. I will say now, there's a lot more choices. So even if you want to be clock in, clock out, meaning no call, I mean, hospitalist, intensivist. I thought about doing a critical care fellowship. I really did like critical care. And so I did consider that. But we get plenty of critical care in the ED, so that was enough. But what I will say is you gotta really take a step back and just look at like the whole lifestyle. That's why I said, look at the big picture. Like cardiology may be fine, but if you work in like this isn't really a big city, Springfield, but we have two busy level 1 traumas here. Cardiologists that are on call, they're coming in all the time. We have CMH, that's up in Bolivar. That cardiologist comes in like, once every third call, right? So you also can look at that and see like how often, even if you wanted to do cardiology, you want to come in on call. But there's a lot more choices now for clock in, clock out. Like I said, hospitalists, intensivists. At Mercy, we just started an acute care surgical service. So now even our general surgeons are like 7A to 7B something. They have this like all worked out. But anyways, they come and they work and then they go home and they don't get called. There's also, I think, we have OB hospitalists. If you thought about doing OBGYN, we have OB hospitalists. So I think our hospitalists, they just work either during the day or during the night. And it's like a week on, week off. No call. Trying to think what else. I think like radiology, most of those are like, shifts now. Our radiologist is a little bit different, but even if you want to be an interventionalist, they do shifts. So there's a lot more choices for shift work, or like I say, no call, clock in, clock out is what we say. There's a lot more choices now. So, I mean, most hospitals, if you're looking to be out here kind of like in the rural situation, might not be as clock in, clock out, but like at Mercy anyways, we have several specialties that are now no call. So that was a long answer, but just think about those things though. When you're picking a specialty, it's all in that decision-making process. You gotta wanna know. Because if you don't ever wanna be on call and you pick a specialty that's on call, you're gonna be real crabby to everybody. Real crabby. So, anything else? And I would say too, another piece of advice I tell some med students that have rotated with me. If you're thinking about a fellowship, consider the place you want to live. So like wherever you're going to end up, you could do a fellowship for like no reason. Because number one, you want to be sure that you can use your fellowship. And number two, you want to make sure you get paid to be fellowship trained. So just like here at Mercy, we did have some PZR docs. But like before they even came, we saw all the things, right? So like our shop that kind of has a separate PZD, but we man it anyways. It's really not there's no reason for you to go get a PEDS fellowship if you want to work in the ED there, because we just all see everything. Sometimes some PIMs come in and do locum shifts and they'll just see the kiddos, but that's just an example. Like just make sure that if you want to take the time and effort and everything, just make sure that where you're going to be or where you want to look for a job, you'll actually be able to use that fellowship and get paid to be fellowship trained, because that's a bargaining chip. Okay. Anything else? You guys welcome to come to the ED anytime. Happy to have you. I also am the director at the Mercy Advanced Care, so it's like our freestanding ED sorta. We don't take ambulances, but we see kind of everything there. So happy to have you there too. It's organized chaos there. It's very calm and quiet and nice. There's not monitors and bells and whistles and loud things going off all the time, so it's actually nice to go there because you can see all the kinds of acute things. It's a little bit slower pace. There's not like all this noise all the time, so happy to have you there too.
Thank you.